Hey there, healthcare professionals. Today I'm diving into a crucial topic, postpartum complications. Let's break down what every new mom should know. First up, postpartum hemorrhage or PPH. This is excessive bleeding after childbirth, more than 500 milliliters after a vaginal birth, or 1,000 milliliters after a C-section. It's the leading cause of maternal mortality worldwide. Common causes: uterine atony, where the uterus doesn't contract effectively, retained placental fragments, lacerations, and coagulation disorders. Picture this: a woman who just delivered vaginally starts bleeding excessively within an hour. The healthcare team jumps into action with uterine massage and medications like oxytocin, searching for any retained placental fragments or lacerations needing repair. Next, we've got infections. Postpartum infections can hit the uterus, surgical sites, urinary tract, or breasts. Symptoms vary: fever, uterine tenderness, and foul-smelling discharge for endometritis, redness, swelling, and pus for surgical site infections, and painful, red, swollen areas on the breast with fever for mastitis. Imagine a woman developing a high fever and lower abdominal pain days after a cesarean. Her provider diagnoses endometritis and prescribes antibiotics, plus rest and fluids. Now let's talk about postpartum depression or PPD. This severe, long-lasting depression can occur within the first year after childbirth, affecting a mother's ability to care for herself and her baby. Symptoms include persistent sadness, loss of interest in activities, difficulty bonding with the baby, changes in appetite or sleep, and thoughts of self-harm or harming the baby. Imagine a new mom feeling overwhelmingly sad and disconnected from her baby weeks after delivery. With her partner's encouragement, she seeks help, gets diagnosed with PPD, and starts therapy and medication, gradually feeling better. Deep vein thrombosis, or DVT, is next. This blood clot usually forms in a deep vein in the legs and can be life-threatening if it travels to the lungs as a pulmonary embolism. Symptoms include swelling, pain, and tenderness in one leg, along with warmth and redness. Picture a woman noticing swelling and pain in her calf a week postpartum. Her provider confirms DVT via ultrasound and starts anticoagulant therapy. Postpartum hypertension and preeclampsia can also develop or persist after childbirth. Symptoms include severe headaches, visual disturbances, swelling in hands and face, and upper abdominal pain. Imagine a woman with severe headaches and visual changes 2 weeks postpartum. Her blood pressure is high, leading to a diagnosis of postpartum preeclampsia. She's admitted for monitoring and treatment. Urinary incontinence is another issue. Some women have trouble controlling their bladder, especially after vaginal delivery with significant perineal trauma. Picture a woman leaking urine when she laughs, sneezes, or exercises. Pelvic floor therapy helps strengthen her pelvic muscles and improve bladder control. Lastly, breastfeeding complications like engorgement, mastitis, and cracked nipples. Imagine a mother with a painful red area on her breast and a fever. She's diagnosed with mastitis, starts antibiotics, and continues breastfeeding with warm compresses and proper latch techniques. In conclusion, postpartum care is essential to address and prevent these complications. As healthcare providers, your role in educating new mothers, offering support, and intervening promptly is crucial. Regular follow-up visits and open communication can significantly improve outcomes for both mother and baby. Thanks for tuning in. Stay informed and continue providing exceptional care.